Assalamualaikum warahmatullahi wabarakatuh, and hi to Dr. Ishaku and my fellow friends. My name is NURUL Hanis binti DERI. Today, I'm going to present my research proposal which titled Effective Communication Between Health Professionals and Patients at Hospital SULTANAH ZAHIRAH. There are 8 things that I will talk today, which are background of study, problem statement, research objective, research questions, significance of study, theoretical approach, methodology, and major reference. First and foremost, for background of study, when we are able to clearly convey our message to the audience and they understand it, we are said to be using effective communication. Our personal and professional life depend heavily on this connection. In order to communicate information more clearly, comprehendingly, and empathetically, it entails acquiring specific abilities by ZAHIRAH 2023. Fostering the development of therapeutic connections between healthcare providers, patients, and their significant others based on reciprocal trust, dignity, understanding, and sharing of human experiences is essential to establishing a person-centered healthcare environment. The effectiveness of communication between healthcare specialists in the critical care unit was examined by Wang, Wani, Zhao, and Shan 2017 through the use of an integrated review technique. It was discovered that effective multidisciplinary communication is a crucial prerequisite for the provision of high-quality healthcare. In healthcare setting, electronic documentation, patent, staff training, structure shift, and communication checklists all improve communication. Besides, there are 2 problem statements that provided in this research, which are miscommunication between health professionals and patients can lead to conflict. According Moore and Cordic 2006, conflict research approach has not previously been used to investigate the sources of conflict with healthcare practitioners. Several conflict theories suggest that conflict may arise from misunderstanding, conflicting interests, or unfulfilled human need. By applying this idea to a conflict, one may first determine what caused it, after which one could either address unfulfilled human needs or clarify communication. Conflict analysts acknowledge that conflict can also result from divergent values, but they view this kind of conflict as problematic because it is not resolved by compromise or other conventional methods of problem solving. Then, for the other problem is different cultural and language barriers that lead patient challenges in understanding health-related information. In the healthcare environment in Malaysia, according Singleton et al. 2011, language English proficiency (LEP) patients have an increased risk of incorrect diagnosis and treatment, as well as communication hurdles that make it difficult for them to fully understand written instructions on how to obtain or maintain insurance. As a result, LEP patients could stop getting preventative treatment and limit their medical attention to acute or chronic conditions. It is critical to investigate methods for resolving communication barriers since the health and welfare of LEP patients are threatened. Patients who are not fluent in English have few options for communicating with medical staff when they don't speak their language. Furthermore, there are also 3 research objectives, which are: number 1, to ascertain how doctors communicate with their patients; number 2, to explore culture and language that affect health professionals and patients; number 3, to identify the factor affecting the patient's anxiety during communication with a health professional. As for the research questions, there are also 3, which are: number 1, how do doctors communicate with their patients; number 2, what are the cultural and language barriers that affect health professionals and patients; number 3, what are the factors affecting the patient's anxiety during communication with a health professional. Then we go to the next, which is significance of study. The information provided in this study will also be of benefit to patients and doctors. According Leonard and Frankel 2011, it takes a strong team and effective communication to provide safe, dependable healthcare. Nowadays, between 25% and 33% of hospitalized patients have an adverse event, most of which are thought to have been preventable. Effective teamwork training and execution require a cultural shift that emphasizes how competent individuals collaborate in complex organizations. Additionally, detailed explanations to patients can be provided by healthcare providers with the use of excellent communication. The findings of this study will provide useful information about the ability of healthcare workers to communicate effectively and efficiently with one another is critical because it impacts patient outcomes and safety. The acknowledged, introduced, duration explained tank, AIDET communication framework and the situation background assessment recommendation SBER framework will help to improve listening and communication skills between patients and healthcare providers as well as the consistency of communication within the medical staff. Improving communication within healthcare institutions can enhance patient safety and lead to higher level of patient satisfaction by Bergana 2020. Moreover, real-time information is necessary for the ministry to react quickly and effectively during public health emergencies such as pandemic or natural disasters. Besides, for theoretical approach, the interpersonal communication theory will be adapted to guide the study. Using Miller's definition, IPC interpersonal communication happens between two people who are near to one another, have the ability to respond quickly and are able to use a variety of sense. For health professionals and patients to communicate effectively, interpersonal communication is essential. The effectiveness of the communication can have a significant impact on patient satisfaction, treatment, outcomes, and the entire healthcare experience. Patients' rapport and trust with healthcare providers can be strengthened through interpersonal communication because healthcare provider can give exact, individualized data and patients have to disclose their private information. Trust is crucial. According to Vimala 2021, it is simpler when there is a positive doctor-patient relationship, especially when there is unpleasant news. As for research method, this study will employ a qualitative method in which semi-structured interview and thematic analysis will be used to collect and analyze data respectively. The most popular sorts of qualitative approach which are developed to have a comprehensive and in-depth understanding of the issues through their textual interpretation are observation and interviewing according Jamshid 2014. For the method of data collection, using pervasive sampling, sick participants will be chosen for the population and sample size. The data will be collected from a sample of sick participants in a selected clinic within Terengganu. The participant consists of 3 doctors and 3 patients from these selected clinics. Only doctors and patients are the participant and cannot include nurse or the other staff. Then, for the method of data analysis, the data of the study will analyze in thematic analysis and how it will be used for the study. So the first step of thematic analysis are by defining research questions and objective, then doing data collection through an interview. This interview will be a focus group which will include sick participants of doctors and patients in a selected clinic within Terengganu. Thereafter, the interview will be transcribed. Patient, attentive listening and meticulous editing are necessary when writing an interview transcript. Additionally, data analysis will be complete following transcription. Data analysis is a crucial step in the research process because it turns unprocessed data into information that is relevant, helps draw conclusions, and advance our understanding of particular topic. Research findings are validated, dependable, and interpretable with confidence thanks to a methodical and exacting procedure. Last but not least, there are 5 major references that I use, which are Bergener AM 2020, Enhancing Communication to Improve Patient Safety and to Increase Patient Satisfaction. Besides, Anderson 2019, Communication between Healthcare Professionals and Relative of Patient Approaching the End of Life, a Systematic Review of Qualitative Evidence. Besides, I also use from Shitu Hassan, which is Avoiding Medication Error Through Effective Communication in Healthcare Environment. Besides, I also took from Leonard 2011, which is Role of Effective Teamwork and Communication in Delivery Safe, High Quality Care. And I also took the sources from Mira 2012, which Barrier for an Effective Communication around clinical decision making and analysis of the gaps between doctors and patients. I think that's all from me. Thank you and have a nice day, everyone. Goodbye.